Let's dive into some of the audience analysis aspects of conducting a healthcare campaign. When we're analyzing our audience, we need to be researching the demographics, the attitudes, beliefs, current behaviors, and rationale for current behaviors. So, as we're looking at this, what we want to be doing is dividing up our audience into subgroups based on these different types of meaningful criteria. And the purpose of audience analysis is to impact the campaign messages. Because remember, if we start creating generic type messages, we have limited the impact of our potential messages. Whereas if we create more specific and targeted messages for our audience members, we have the ability to be more effective for them. It allows us to segment our audience to create those targeted messages. For example, high sensation seekers need messages that are going to promote more fast-paced, exciting, more close-up shots, more music, more rapid cutting between things, because it affects the way that they look at the world. If they're a high sensation seeker, they need to play into the idea of how they like to live dangerously, how they like to have unique experiences and things like that. Now, audience analysis can be conducted in a number of ways. One of the ways we can do that is by looking at the available data that's had by hospital patient records, local and state governments, employee records, government databases, U.S. Census, the CDC, the National Institute of Health, that type of thing. In addition, we can also create our own primary research. We can do surveys that would look at things like age, gender, ethnicity, income, current health-related behaviors, attitudes, belief about health, self-efficacy, skills, and other questions to understand the necessary components to creating an effective campaign. Ultimately, the goal being seeking what is going to motivate our audience members. We can try to seek a sample of the population that's representative, but in all likelihood, we're not going to be able to get a probability sample. We're more likely going to be trying to get a non-probability sample found through convenience sampling. We also might consider doing a focus group to try and understand more about our targeted audience members, but even though we can sometimes get more rich information because someone will remind another member of that focus group that about one of their feelings or things along those lines, we might also find that individuals are afraid to speak up in a group, so we're missing important pieces of information about our audience. In the example of the VD poster, the assumptions that the healthcare campaign creators were basing their campaign on is that the audience is young. They might be sexual partners of this man, which also means that they are also having sex. They're not currently using protection from VD. They might know VD is bad, but they're not necessarily acting on it yet, which goes back to that idea of pre-action. Perhaps they believe that a partner would tell them if they have VD. They may be more trusting of other individuals. They might also be specifically targeting the Italian population, suggesting that this man Mario, with the name Mario chosen for this specific campaign, might be a sexual partner of individuals of the same cultural background. They may also be specifically targeting individuals of a lower level of income because this is from the City Free Clinic. They might also be targeting people of a lower literacy level. Not that someone could be able to read this if they had a very, very low literacy level, but if you're looking at the words that are on the actual poster, you're not looking at words that are above a certain grade level. It's all fairly simple words to be able to understand. So, having looked through this next aspect of campaign planning, what I want you to do is get ready to answer question number 4. And question number 4 wants you to look at the health campaign you've been examining throughout this video. I want you to describe the intended audience of the campaign that you've been exploring. Why do you think this is the target audience that was intended to be reached by the campaign creators? Who do you think they were trying to specifically target for their audience with the campaign you've been exploring? Now let's start creating the message content. Remember that to create an effective message, we need to make sure that our target audience is exposed to the message so they actually can reach it in some way. They need to attend to the message. They need to notice that it's happening. They need to comprehend the message. They need to be able to understand it. And they need to retain the message. They need to be able to remember it. These are all important stages in being able to have an effective message. After we have started to create the message content, we need to start thinking about the persuasive messages that we're going to be able to create. Persuasive messages are going to rely on three basic things: the ethos, pathos, and logos of the message. So remember, ethos is that credibility of the individual and of the message and of the message giver. Pathos is going to be the emotion that's elicited by the message, and then logos is that idea of the logical appeals to reason. But I do want to hit on the idea of the campaign messenger. The campaign messenger is the person who provides the information, testimonials, and or demonstrates behaviors during the campaign. Now, this is the person that is going to be conveying the credibility of the campaign. It needs to be someone who is trustworthy, who's an expert, who's familiar, who has interpersonal attractiveness, and ideally is someone who is similar to the target audience. Now, you don't always have to have a celebrity in this role. Sometimes that's a good idea to have a celebrity, and sometimes it's not. If the celebrity's personal life doesn't match the goal of the campaign, they're probably not the best person to be trying to use in building that campaign. And the sources of information also need to be someone that can be credible as we're thinking about who we might be able to cite for information. We want to have that credible source so that people would trust the information that we're sharing with our campaign. If you could get ready to pause your video and answer question 5. What I'd like you to do is for question 5, I want you to describe the messenger for the campaign that you have been analyzing throughout this video. How did your messenger use ethos, pathos, and logos? What other message considerations did they include in the creation of the message? We've thought about who our audience is. We've crafted a message specific to our target audience. Now we need to think about the channel that we're going to be used to convey this message. Things that we need to consider. First of all, we need to consider the type of media the target audience is going to use. How are we going to be able to disseminate this to them? Should we be using television, radio, print, cell phones, internet, billboards, interpersonal channels? There are peer groups. There's a lot of different ways that we can communicate different messages to different audience members. We need to be thinking about the media these audience members are using. We also need to be thinking about, if we've been choosing a medium, the ability of that specific channel to support a specific message. If we're trying to communicate via Twitter, it might not be the most effective way to communicate using a video through Twitter, because people may or may not click on a video. They may or may not have the image of the video to draw them in. You have a less of a chance of trying to impact them that way. So you may need to be thinking about the message and its ability to be conveyed through a specific channel. You also need to think about audience literacy levels. If your target audience has a low literacy level, you need to be focusing less on text-based messages and more on images or simple text-based messages. We also need to be thinking about the potential impacts of a specific channel. There is a more informal tone to certain channels than there are to other channels. If you're trying to convey something in a workplace email, it would need to be something that would be suited for the workplace, so you don't get someone in trouble. There would be a lot of different things we need to think about as we're considering the channels we want to be using. And it's okay to use a multi-pronged approach, especially as we're thinking about barriers that would be faced by certain populations. Sometimes it's better to be able to reach them through multiple media, and then you have that increased opportunity to influence their behaviors. Now, you want to watch out for the generalized messages versus personalized messages. Generalized messages are going to lack the impact of more specific messages. However, in personalized messages, like the ones where you would use an algorithm to match specific characteristics of an individual and a target audience to a specific individually tailored message, these are going to increase the complexity of the campaign as well as the cost. And sometimes you may have a limited reach of those specific messages. And we're thinking about the accessibility of the channel. Can the target audience see it or access it? If it's on the internet, does your audience have the access to the internet? Because not everyone does. What is the depth of your channel? Can it convey complex information? What's the cost of your channel? And then what is the amount versus the quality of information a channel can deliver versus the cost of using that channel? So, for example, if you're looking at the example we've been looking at, in the show, they showed that the VD poster was put up on billboards and in posters around the city. I wonder where this would be today and if this would be an effective campaign today, or as effective as it was at the time that they were using this in the show. So I'd like you to get ready to answer your question number 6. And in question number 6, what I'd like you to do is to go out and find a resource that provides additional information and considerations about choosing the correct channel for a campaign. Copy that link for me and then summarize a few key points from that research. Now, before we actually launch a campaign, we need to do some pilot testing. Before we sink all the money of a campaign into launching it and then having it maybe have issues, what we want to do is we want to test the materials with our targeted audience. We want to see what works and what fails, the degrees of the changes we see in awareness and in behavior, and then any issues that we might be seeing. Was it understandable? Was it salient? Was the spokesperson appropriate? And after we worked out some of the issues with a healthcare campaign, we then would be able to launch the campaign. And after following the launch, what we'd want to be doing is evaluating the campaign. Now, the length of a campaign is going to depend on the goals of the campaign as well as pragmatic issues like how long people can actually spend on creating the campaign. But after the campaign is over, we need to evaluate it. Well, that's going to add additional costs. Isn't that a bad thing? It's not necessarily a bad thing. What we want to do is we want to be able to see if it was successful, and if it was, why was it successful? If it wasn't, why wasn't it successful? Did it change people's awareness? Did it change their behavior? Do we think it's going to change their behavior down the road? Does it have a sleeper effect working with it? These are all questions we need to be asking because it can be useful for us as we're creating healthcare campaigns in the future. So that concludes our video lecture for today. Please email me if you have any questions, post questions onto our discussion boards, find some way to contact me. I want to be here as a resource for you, but I can only be here as a resource for you if you have questions. Thanks a lot.